Hello, everybody. It's Dr. Eric Balcavage, and we are back for another edition of Thyroid Answers podcast. I have with me, as always, my faithful co-host and the person that probably keeps this process rolling along and keeps us somewhat on time is Dr. Erica Riggleman. Dr. Erica, how are you today?
I'm doing good. How are you doing?
I am doing fantastic. I'm enjoying another day of working on my book. Which is interesting because today, while I'm trying to finish the final stages of my book, we have somebody on who's just finished their book and is getting ready to release, and that is certified nutrition specialist Tiffany Flaten, right? Did I get that right?
Tiffany Flaten. Yep.
Flaten?
Yes.
All right. So my name gets butchered a bit too, but
that's quite all right.
We're going to go by first names to keep this whole process simple, right? I don't want you to have to try and pronounce my last name, and Riggleman's just too dang easy, so we don't have anything to talk about there. So let's do this. Tiffany, I want to welcome you to the podcast, first of all. So welcome.
Thank you for having me. I appreciate it.
No problem. And I want to applaud you for getting a book done on any topic, as I realized, and I'm sure you did, that the idea of writing a book sounds like, I'll just write a book. You know, it shouldn't be that much work and get it done. And it is a ton of work when you really want to do a good job. And as I said to somebody the other day, I think a book just gets abandoned. It doesn't get finished because at some point you just have to cut the cord and say, it's got to go, or otherwise I'll spend the next 2 days,
it's so much work
working on it. So can you we're going to talk about your book, and you've got, we'll talk about what the book's about, and then some of your ideas about thyroid physiology and how to recover. But why are you in this space? How did you why did you become a certified nutrition specialist? Why are you writing a book on thyroid physiology? I think that's important for the listeners to understand.
Yeah, I think, all of us in this space kind of come from a place of, we've been there, we have our own story. And that was absolutely true for me. I write about it a little bit in the book, where I started back in, I can go back to high school even, but for sure in college with, pretty severe symptoms where they were debilitating, with fatigue and depression and anxiety and, a laundry list of other things I could just go on and on about, but I won't to save your listeners. But I just always would ask to have my thyroid tested, and they always came back normal. And, despite my classic signs and symptoms, and I didn't know that they weren't testing anything other than TSH. And, this went on for years and years and years, tons of doctors, tons of medications, tons of, anything from psychologists to psychiatrists to neurologists to endocrinologists to intern, just constant something going on with me, and just always being sick, just always feeling, whether I was kind of flu-y feeling, I don't know how to describe that. It wasn't like the actual flu, but I always just didn't feel well, and I was sick so often. And, jump forward to 2007, and I got diagnosed with thyroid cancer just from a routine yearly physical. I actually went to my physical to just a general practitioner, and, she felt my neck and she said, there's a lump here, but most of this is benign. It's not a big deal. But I came away from that appointment, and I just knew that it was cancer. I just knew that for some reason in my gut, and went through the process of, getting an ultrasound. And even my first neck ultrasound, it was probably within the next week of that appointment, it came back normal. And yet the doctor said, I really think you need to go see an endocrinologist, despite this being normal. Again, this 98% of these are benign, it's no big deal. And so I then followed up with a doctor at Mayo Clinic in Rochester, not very far from where I live. And I brought my thyroid ultrasound with me, and he said, we do our own here. We'll just do our own, we'll start from scratch. And there they, found it and did the fine needle aspiration. And I think they took 6 passes or so, and it was metastatic papillary, and it spread to the lymph nodes. And, so then that started the treatment that I went through, kind of the standard treatment protocol, which is, at the time surgery and radioactive iodine and all that kind of stuff. And I really thought my symptoms would improve when I get on the right medication, have that, dysfunctional thyroid taken out of my body, and things actually got worse. And, long story short, it brought me to this journey of really diving deep into nutrition and looking at how nutrients that are really supportive and helpful for thyroid conditions, support your feeling better. And it's not just thyroid, it's stress, it's blood sugar, it's, all these other things that need to be addressed. So it's, kind of a big process, and people usually don't get that information. It's very compartmentalized. And so that led me to quit my job. I was a high school biology, anatomy, physiology teacher, and had my master's in education because I was a teacher, and I was going to, do all the things with that, and, just keep on that process. And the stress and my health just did not work with that. So then I quit that job, and I went back to school to get my master's in nutrition. And that's what helped me. And that's the missing link when I talk to so many people, is just looking at kind of back to basics nutrition, more focused with some thyroid stuff that people don't really understand go together. So that's how I got to what I do.
Okay, so for the listeners, I want to kind of backtrack a little bit so that they have a little bit better understanding, because not everybody might be familiar with the whole process, right? So
right.
You have tiredness, fatigue, you have all the symptoms of hypothyroidism. Now, we talk about this all the time, that hypothyroidism starts in the cells, right? Some type of excessive cell stress causes thyroid hormone to be deactivated, and that's what results in the symptomatology, is you don't have enough T3 getting to the receptors. So at the end of the day, it's not about what the gland's doing per se, at least early on, it's about what's happening at the cell. So if that excessive cell stress persists, then we can get a cascade of issues that occur. Cells in stress, cells in danger can release these things called DAMPs and PAMPs. DAMPs and PAMPs circulate in the bloodstream. They activate the immune, the inflammatory process, and the thyroid gland is super, super sensitive to these things called DAMPs and PAMPs. And when the thyroid cell actually starts to perceive these, and not just the thyroid cells, but what are called myocytes, which are another type of cell within the thyroid gland, it actually triggers almost a self-destructive mechanism. Okay, so the thyroid cells start to create some inflammatory response, and they actually trigger the stimulation of the immune system, the innate immune system, to come to the thyroid gland. And that's where we get the infiltration of lymphoid tissue. We get inflammation occurs there, and we start to get destruction of the thyroid cells. In some cases, some people the damage that's caused by that inflammatory process in the immune cells produces enough tissue damage where the body actually starts to make some antibodies against that debris. Okay, there's sometimes, I think, confusion as to that. We think that the thyroid antibodies are the thing that's destroying the thyroid gland, and that's really not the case in most situations. But there's damage to the tissues and there's damage to the cells, and that damage, if those cells are left to proliferate, you can start to develop things like cancer, these abnormal cell growth. And in your situation, you got the cancer. And what's interesting was at the time that you had the diagnosis, did you have an elevated TSH?
No, it was roughly like 2.5. I mean, it's not optimal, but it was for sure in the normal range. I think the range that they used was 5.5, was up to 5.5. So it was pretty broad, and I was 2.5 or something like that. So they would never have done anything about it otherwise.
Right. Which is exactly why we cannot use TSH as the only marker of thyroid physiology, because just like in your case, for the listeners, is really important, TSH doesn't typically rise above lab range until you've had greater than 90% of the thyroid gland damaged. Okay, so it is not an early indicator of thyroid physiology changes or damage to the thyroid gland. You can have nodules, you can have thyroid cancer. It was thought at one point that TSH was the most sensitive marker to thyroid gland damage. It is not if you can have thyroid cancer, not if you can have nodules, and not if it takes 90% of the thyroid gland to be destroyed before you start to get an elevation of TSH. So that being said, the next thing you did was you had treatment, right? So you have, hey, let's take out part of the gland, or let's take out the whole gland, right? And then let's radiate whatever's possibly left to make sure we've killed off everything. And therefore there's nothing left with the thyroid tissue, problem solved. And then we're just going to put you on thyroid hormone replacement therapy. And if we put that in, then the thinking of the day is that as long as you put enough thyroid hormone into the system, it's going to passively diffuse into the cells. Since the cells don't have any control over what happens to thyroid hormone, T4 converts to T3, T3 binds to receptors, and everything is kumbaya, and you should be fine. Right?
Yeah, completely easy, because this is the easy cancer to have.
Right.
Did you ever have antibodies tested prior to any of the testing that you did?
No, they only tested TSH. I think they, prior to treatment, I believe they tested TSH, maybe a T4, and a thyroglobulin. And they did not test antibodies.
I would be really curious to know whether, you had antibodies, at that time prior to it, if that was part of what Eric was saying, part of that kind of cascade that initiated some of those responses. And I think that your story is kind of classic. I've seen a lot of patients that have had thyroid cancer, even because of autoimmunity, have their thyroid removed. And they're often just told like, oh, it's not a big deal. It's just a gland. We'll remove it. And we'll just give you your hormone and you'll be on your merry way.
Yeah.
Had your doctors prepared you for anything that could happen after that, like as it relates to side effects or anything that you could see after removing the gland?
Zero. Because the perception was, and the message I got from every person, even on the way down to the operating room, every door you go through and every person who checks your wristband and all that stuff, was, this is the easy cancer. Don't worry about it. You're going to feel amazing. I mean, just nonstop. That was what was reinforced. And so that, of course, was my expectation. I could just take a couple of weeks off of work and it was no big deal, except for the fact that I couldn't be on medication because I was getting ready for treatment. So I had no thyroid gland, no medication to replace any hormone that I was getting or should have been getting to get ready for treatment. And it was not a big deal. I was just going to feel a little bit tired maybe by the end of the few weeks. And then there was a glitch with nuclear medicine department with my scheduling. So I had to wait longer. It got to be more like 6 weeks or 8 weeks or something like that. No gland, no medicine.
So when you got diagnosed with thyroid cancer, was there an explanation or likely explanation given as to what the potential cause or causes may have been?
No, nothing. It was, I mean, nothing. It wasn't even discussed.
It's just an idiopathic thing, but that it was just more described as, you have thyroid cancer. We're going to fix it for you. This is the easy one. We're going to take everything out. We're going to put you on thyroid medication. Everything will be good. Right?
Yeah, no big deal.
So that comes to the follow-up question is, you get the treatment done, you get put on hypothyroid medication, the doctors achieve what we call biochemical euthyroidism. They give you enough thyroid hormone to bring your TSH into normal levels. And then at that point, are you still symptomatic? Now you still have all these hypothyroid symptoms? I
feel like I was probably more symptomatic, to be honest. Yeah, so they put me on T4, on Synthroid. And, I remember asking, how is my body now that I don't have this before I researched anything. And even though I taught it every year in my classes, I asked him, how do I convert into T3? And he just said, it just does. Your body just does it. So I looked further and I obviously saw where there was a lot more involved in that, but my body wasn't doing that clearly. And I was suppressed. So the goal and I don't know if it's changed now, but the goal at the time was to be at a suppressive level so that my TSH is always less than, it's 0.08 usually, and they still keep it that way to suppress cancer growth. Yeah.
So the concern is, one, the assumption is that we're going to drive TSH really low. So if there's any peripheral thyroid tissue available, keeping it this low. And for the listeners, if you provide plenty of T4 into the system and you drop TSH super low, the thought process is any thyroid tissue isn't going to try and start to produce thyroid hormone because the body's saturated.
Right.
The challenge is, and you found this out, which is probably what led you to the book, is when you drive TSH that low, if there's a pre-existing condition going on that's creating excessive stress, the hypothalamus and what we call the central regulating thyroid regulating system behaves one way, the peripheral system behaves another way. And so the understanding by doctors to say, we're going to drive this TSH as low as possible to prevent any potential cancer creates a problem, because the hypothalamus converts T4 to T3 much faster, much quicker, which means that then signals are sent to the body, and the T4 in the peripheral tissue doesn't get converted to T3 because the enzyme deiodinase 2 is the thing that then gets deactivated, so you can't convert it. The only thing that really gets done well is the conversion, the deactivation of thyroid hormone, T4 to reverse T3 and T3 to T2. Nobody, I'm assuming, explained to you that there's a central regulating system and a supply that's circulating in the bloodstream, and then there's a peripheral regulating system which controls what happens in the individual cells and tissues, right?
No, zero explanation of that because of the treatment protocol. And I went back saying, okay, I appreciate you keeping my cancer at bay. I mean, I thank you for that, but I also needed to function, and I was not functional. I had two little kids. They were 3 and 6 at the time, and my husband traveled at least, I don't know, half the time probably, and I was working full time and teaching high school biology, anatomy, physiology is just high school kids in general. It's challenging, and when after I did my surgery and I think it was my first treatment. I had a recurrence about a year after this too in the lymph nodes. But after the first surgery and treatment, I got back and I was teaching endocrine system, and thyroid was first. And the first sentence said, thyroid hormone affects every cell in the body. And I'm just like, whoa, I just had this removed and without question, because you're scared and they tell you this is what we do. And I'm not saying I would have done anything different based on the situation I was in, but it was just, that's when I was like, okay, this is way bigger than just taking some Synthroid for the rest of my life, and I'm thinking I'm going to feel good. This is not going to be how it works. And they weren't really interested in looking at other things like you were talking about with the peripheral system. It was more just take your Synthroid, let's suppress the TSH and call it a day.
And to be fair, right? The medical doctors are there. Their focus is acute care, crisis management, and the management of disease. And so they were doing exactly what they were trained to do. The challenges that we see with a lot of thyroid patients is normalization of TSH with thyroid hormone doesn't fix. If you don't have any excessive cellular stress going on in the body and you put thyroid hormone in, it will convert to T4 to T3, T3 to T2, and the physiology will work. However, if there's pre-existing cellular stress going on, the same mechanisms that were in play that caused the problems to begin with are still there, which is what you found out. So how does now finding out that, hey, this isn't working, lead you into this path of starting to get your nutrition certification, to then come up with a plan and a book and a strategy, and then helping patients? How do you go from patient, right, to advisor?
Yeah, so I think when you have something happen to you, you start talking with people and everybody comes out of the woodwork that they have the same scenario, yet at the time you feel like you're the only person because you feel like you're an anomaly with everything. So I felt like I was by myself. Then I realized, no, lots of people struggle with this situation. And I have the science background already, always super interested in that type of thing, and always very, very interested in nutrition. And so when I was looking at all the things that they were having me do with, I shouldn't say all the things, but having me do the medication and just basically sit and wait for it to work, and then it'll take some time or whatever, is kind of what they decided to, we'll just take time. So after 3 years, I was like, through this whole process, I was really digging into nutrition. I started figuring out stuff about food sensitivities, and allergies and how stress impacts and other hormone levels. And I started basically doing everything to with myself, seeing every practitioner that made sense for the things I was looking at, naturopathic physicians, nutritionists. And I realized, like, okay, I can do this. I maybe don't have, at the time, I didn't think I had time or the energy to go back to naturopathic medical school or anything. So I just dove into the nutrition because that's where I always had interest. And that's how I kind of created what I put in this book, is what I did with myself. Just, kind of elimination, not like a typical elimination diet, but just a progression, a methodical approach to, cleaning house, resetting the body, and then learning to add things back over time, looking at nutrients that might be deficient according to white blood cell testing, to look at where, functional deficiencies lie, so that those can be replenished to help support the thyroid or other processes are happening. So that's how it came to be.
So there's a lot of people talking about, if you have hypothyroidism, this is the type of diet you have to follow, AIP. What makes your process, the 8-week Rock Bottom Thyroid Reset, different, right? Why is that? What's different about your diet than we might see in a typical AIP type protocol or autoimmune protocol?
Well, first of all, it gives people some other ways to look at the way that people are eating, not just what they're eating, but the way that they're eating, as far as composing the meals with macros, where they can start to get little wins. They can start to balance their blood sugar. They can start to level out their mood. They can start to level out cravings. They get little wins so that they have that motivation to keep going, because people like I was, if they're in the situation like I was, they have no motivation or energy or ability really to think about what they need to do and to make the efforts to do so, because they're so exhausted. So I wanted to put things in a simple way, just starting out with making sure that macros are in check, just for example, to get them balanced out so they can start to feel a little bit leveled off. That sets them up for being able to do the next thing and the next thing and the next thing. And it becomes customized with some of the work that if people work with me one-on-one, we get really customized, and it's not just an AIP or a paleo or a vegan or whatever. Everybody seems to feel better eating a certain way, but we take a process in order to figure that out for the individual. So it's not just this one size fits all thing, I guess, is what I'm trying to say. But it's just that start of feeling better and being able to keep progressing and realizing that, okay, if I just say I'm going to cut out gluten, and if that doesn't work for me, people don't know what else to do, because gluten-free diet becomes such a like a buzzword. It's almost in a way, it's a fad for people. They don't really understand the why behind it for thyroid conditions or whatever. So that was kind of the premise, something that gets back to basics, makes it simple, get some simple wins for people who are exhausted.
What can people expect from the Rock Bottom Reset program? Is it just for weight loss? Is it for, diet for thyroid health? Is it an exercise program? And I think you said it's like 8 weeks long. What can people expect from it?
Well, I think of the 8 weeks as sort of a place to start. And it's like I said, it's kind of a methodical approach. When people work one-on-one with me, sometimes it becomes much longer than 8 weeks. But to start with it, like I've mentioned blood sugar to begin with, I feel like everybody I see has something imbalanced with their blood sugar. They have a lot of symptoms that correlate to that. So, they report feeling, they have more energy, they start to lose weight, and probably initially in the form of inflammation, of course, losing that inflammation. They decrease their headaches, they improve their joint pain, it becomes a lot less. Just in the first, month or so, they start to get relief from that. And like I said, that starts the snowball effect of, having them improve even further. And then once they get healthy, then weight loss can happen a lot easier. With people with thyroid, obviously that's a concern that comes with the territory. And, people want to lose weight to get healthy and not the other way around. So it's sort of helping them realize that this is a process and it becomes customized to your needs. Because if people, and this goes back to my teaching background, it's that metacognition, you don't know what you don't know. And a lot of people don't have a clue what their own body needs because they're following diet recommendations from, Pinterest or from an infomercial or, whatever. So that's where that comes into play, and that's how, what they expect to get from it. And that's what people are telling me. And I've been like, this, so I did to myself many years ago. And this is what people are reporting during my programs and going through this process.
Do you ever co-manage with a functional medicine practitioner or an integrative doctor to help manage, from the medical side as well as the nutritional side?
I try. It's hard where I'm at, finding someone who is open to do that, or that will manage their medications and their testing based on my recommendations with their nutrition part of it. So that's been a little bit of a struggle, but that's what I would love to do. I would love to have, someone I can refer people to have a blood draw for their full thyroid panel, so they can get all the information that they really need and not just a TSH. So I've had a little pushback on that from some of the patients' doctors.
So one of those things that I think Dr. Eric and I would agree with you totally is that a gluten-free diet is not necessarily the solution to addressing a thyroid physiology problem, because thyroid or gluten reactivity may be an issue. It may not be an issue.
Mm-hmm.
It may be part of the issue, but it's typically not the only issue for the vast majority of people. There's other factors.
Right.
So we see people that do a gluten-free diet and they seem like they feel a little bit better. Then all of a sudden they're having return of symptoms and they're reactive to a whole bunch of other foods. So if somebody is looking at your process, like what's the foundational diet? Because you're coming at this from a nutrition aspect. So what's foundationally, you're saying there's a systematic process, and I know we'd all agree that you have to make each person's diet kind of unique to them. But what's the foundation? Yeah. What are the general recommendations in your nutrition plan that when you're talking to somebody who's got a thyroid issue, what are you recommending them, big picture, that they need to do so that the listeners have an understanding?
Yeah, it's really, really simple. It's basically combining or making sure you're getting the 3 macros at each meal. So proteins, fats, and carbs. And of course, whole foods at baseline, right? Not, all the foods that are left right now in the grocery store are the whole foods, from what I've seen when I've tried to go grocery shopping in this situation we're having right now with the virus and everything. So focusing in on those whole foods, the whole food carbohydrates specifically versus, using gluten-free replacements of your old favorites, buying gluten-free cereal versus just regular cereal. That's not what I'm talking about. So whole foods, proteins, fats, carbs at each meal, smaller version if people are doing snacks to help with mitigating the blood sugar. And then with, I think the other thing, I do start people on a process of cutting out the gluten and the dairy to kind of see where that inflammation process is happening from them, from the foods that they're eating. And then, healing the gut with the whole foods as well over time. So that's sort of at the core of it. And people start to see that, how things are affecting them. But to your point, not everybody takes away gluten and feels amazing and different after, a time. So it's a way to check and see. And then we add, past that first, say, month of time, or 6 weeks or 8 weeks, depending on the individual, how they go through the process. Then we moderate that according to their symptoms, but it has to go by, making that connection, connecting the dots with their symptoms versus what they're eating. And when people figure that out for themselves, that's when they start to really start healing. Because if you don't know what you're doing or why you're doing it, it's really hard to stick with it. So that would be the core of it: proteins, fats, carbs, gluten and dairy free to begin with, and then we figure things out from there.
Okay. I don't think that's too different from what we talk about on a regular basis, which is get rid of all the processed food and eat as much real food as possible, as close to the way it walked the earth, swam the ocean, plucked from the plant or came out of the ground. So
Yeah,
I think that's a good place for almost everybody to start.
absolutely.
And then from there, things get tailored. So do you typically, in your process, are you running lab tests? Are you running blood work or GI tests or any of those things? Or are you trying to do everything with dietary changes at the start?
Yeah, I mean, I stay in my lane with the micronutrient testing, looking at vitamins, minerals, antioxidants, amino acids. So I look at a panel where it looks at the white blood cell levels of those nutrients. When it comes to, GI testing or, getting the full panel for thyroid testing and things like that, I, refer on to that, of course, but like I said, that's a little difficult. Some people, some practitioners are more open to, having the patient say, okay, my nutritionist is recommending that we do these tests, and they'll do it, and others won't at all.
Yeah, so that's really where you'd be best paired with more of a functional medicine practitioner. Because for the listeners, if you go to your primary care physician and said, hey, my nutritionist is recommending you do a GI stool ecology test, they're probably going to look at you like you have three heads and tell you that the nutritionist is a nut job. However, if you say, hey, I'm working with a nutritionist, and they refer you to a functional medicine practitioner, and you say to them, hey, my nutritionist says I need to do a comprehensive metabolic panel or a stool ecology test or a Dutch hormone test or some type of functional testing, most functional medicine practitioners are going to go, oh yeah, that's probably not a bad idea to evaluate this process.
Right.
It's just two different types of practitioners. So that's important to know. So beyond the dietary stuff, are you finding that there's other things that you need to do with your clients to help them heal and repair?
Absolutely. And that's, again, looking back to how I helped myself, and, still a work in progress with a lot of those things. But I have a 6-month program where that's where it's all kind of encompassed in that program, where we deal with lifestyle things such as sleep, stress management, self-care strategies, emotional eating. That's the other thing that's a part of it. I think a lot of people, I'm just sort of generalizing here, but I feel like a lot of thyroid people, and probably people with other conditions too, have created their own little version of eating disordered eating because of their frustration and their inability to lose weight, or their, gaining weight overnight, it seems, or, whatever their issues are with that. And so dealing a lot with that emotional eating piece, and going through that whole process with them, taking them through 6 months of just, adding those things in. So of course, not to stress them out even more, because thyroid people seem to be very high stress, like the rest of our society, I guess, but it's like they don't physiologically manage stress very well or efficiently. So it's just really the whole lifestyle piece, and encompassing all those things, so that they could heal and help the other processes that, or when you're talking about my situation, all those things that were happening before the cancer diagnosis or the Hashimoto's diagnosis, or whatever it is for people, that needs to disappear so the thyroid can work more efficiently.
Yeah, I think that that emotional eating is a big part of it, because not only are people, there's so much information on the internet, which is a blessing and a curse.
Yes.
I think people who have health challenges, they often go to Google and they do their own, Google doctor stuff, and they find everything from this to that, and they're confused, and they think that this is the one thing that's helping me, and they read it and they're committed to it, and then they may go to a nutritionist or a regular medical doctor, and they say, oh, no, there's no science behind that. And so they get very confused.
Yes.
Or they were attached to it, and then it gets ripped away from them. And, having thyroid issues to begin with is an emotional thing. Your emotions are high and low. You often have sex hormone issues. So you may have anxiety and depression, and, not be able to sleep. So you're already in that kind of stressed state where there is going to be emotional attachment to a lot of that stuff. So I think that is important to address with a lot of people.
Yeah, it's, they become so defeated. And I know I was, because, I just assumed that the people managing my cancer cared about that other stuff. And like we mentioned earlier, they're just in the disease management state. And I didn't really realize that until I was in it, and then had to do my own digging and looking into other practitioners. And I have to say, the first time I went to a naturopathic physician, and here's my laundry list of stuff I'm still dealing with. And she said, I'm not surprised you feel the way you do. Like, this makes total sense. And I was like validated for the first time. And then that's when that, hit the ball running for me with looking at all these other things that I knew there had to be some other answers. And if I would have gone to Google and whatever for every little thing, I would have been overwhelmed, defeated, and just quit. It's devastating.
Yeah, and I think for the listeners, and you're going to express this in your book, it'll be a big theme in my book. And we talk about thyroid physiology problems. Often people look at the thyroid dysfunction as the problem. And I take a little different opinion on this. I think Erica takes a very similar opinion to what I say. And you can either agree or disagree and tell us why you disagree. But I look at the thyroid physiology as being an adaptive response, not the problem. And so when the body's under stress, the general change in physiology is the body when times are good and there's no stress on the system, the thyroid physiology helps drive growth and development, proliferation. Under times of stress, thyroid physiology becomes adapted. It gets slowed down in an effort to slow down growth, development, metabolism, and instead upregulate or support cell defense. And so many times what we see is we see somebody with chronic hypothyroid symptoms and we think, oh, you have a thyroid disorder, we need to put more thyroid hormone into the system, long before we really pay attention to realize that maybe the cells and the tissues in the body are trying to actively get rid of thyroid hormone. And the symptoms that we're experiencing are the signs that, hey, there is a problem here. And unfortunately, we've gotten to a point in our culture where instead of asking the question, why is this happening, right? We quickly jump to the management of the symptom or rename the symptom as the disorder, right? And so that becomes a major issue. And so when you developed thyroid cancer, the issues that drove that thyroid cancer were probably still there. Excessive cell stress, you radiate the thyroid, you you do radioactive treatments to destroy the tissue, but the underlying mechanism was still there, which meant that your cells were still going to perceive danger and still going to perceive the fact that they needed to slow down metabolism, which is probably a big reason why, hey, I know my TSH is normal, but I still don't feel good. Do you think along those same lines as we do?
Yeah, exactly. Because I look at just my own example, and now I'm seeing this over and over and over again with people that I'm working with, is that just goes on to the other thing about stress in our society. It's just so normalized and kind of poo-pooed, and we're sort of rewarded for, working all night and don't need enough, we don't need that much sleep and all that kind of thing. But I had just kind of chronic underlying stress from middle school type of age, maybe even before that. There was a heavy burden on me. Just my dad was chronically ill and terminally ill for many, many years. And so that kind of, he died in 2002. And then I had a baby right before that and a baby after that. And, here's this storm of stress, not to mention going to college and, just other life stuff. And so I look at that, and that makes total sense. And that's why I'm so passionate about making sure that people are dealing with those things and learning about how that affects their health. And it's not just, you have a thyroid condition, let's deal with, we can see your numbers are not, optimal, but let's deal with how much are you exercising? Are you over exercising? How are you eating? Are you doing too few calories to try to lose weight? People decide they're going to eat 1,000 calories a day to lose weight because they're, whoever told them that that's the best way to do it. So I have to kind of shift their thinking with that so that they can help support how their thyroid should be working. So absolutely, I agree with that whole thing with the physiology around it, for sure.
Yeah, I think one of the key things is for the listeners to really kind of grab a hold of is that definitely in the model that Dr. Eric and I talk about, and it sounds like in the model that you're talking about, the solution isn't to fix the numbers by
Mm-hmm.
adding more hormone to the system. Like we say, it's not necessarily to fix the gas gauge, make it full, right? It's
Mm-hmm.
to ask why is the body responding this way? And so before you start trying to force more hormone into a system that may be trying to deactivate it, we need to take a step back and say, okay, what's going on here? Why would my body want to slow my thyroid metabolism down? Am I starving myself? That would be a great reason to
Yep.
slow down metabolism. Do I have some type of chronic infection? Because that would be your body would be like, hey, we're slowing down metabolism so we don't allow this bacteria, this virus, this organism to replicate and grow. Am I not getting appropriate sleep, which is a danger signal, right? If you
Mm-hmm.
don't get appropriate sleep, whether it's quantity or quality or both, that triggers a danger signal into the body, right?
Right.
If you don't breathe well, when we talk about people who mouth breathe or snore or have sleep apnea, when you don't breathe appropriately, it creates hypoxia. That sends a danger signal. So I think the key for the listeners is, and it's Tiffany's going to explain some of that in her book, which is, hey, before you need to maybe jump to trying to fix the numbers with a medication that may paint a nicer looking picture, but doesn't actually fix the issue, and in the long run may actually contribute to more stress. You've got to address or take a better look at what's going on in your diet and your lifestyle that may actually be the contributing cause. And you said you did, laying up, prior to your diagnosis, you're saying, hey, I got school, I got a sick parent, I've got a child, I'm pregnant, I got all these things that are accumulating, and you put excessive stress on the system. You couldn't get that balanced out, and that may have been the trigger that created a number of those issues.
Yeah, and it took a long time. Obviously, there's many, many years in there, and it's that whole thing that, like, I try to describe to people, but it's like we're chronically, constantly running away from that saber-toothed tiger, and that, being in that sympathetic state all the time does nothing for us. And but our society is so into that. That's just so normal to just be working 12 hours a day and getting 4 hours of sleep at night, eating, terrible foods because, I don't know, we get a medal for that or something. I don't know what it is. It's people feel kind of prideful about being able to stay up late or work late or whatever it is. So yeah, it's definitely something that I learned, and I actually, it's something you have to keep on to. That's the other thing. You have to keep on that. Just once you kind of feel like you've resolved some things, you still have to maintain and work at keeping your stress levels down to support all the body systems.
Yeah, I think it's a lifestyle that's ongoing. It's not something that you do this 8-week reset and
Right.
then you go right back to where you were, because that's not what it is. For you to have long lasting results, or even healing's not going to take place in those 8 weeks. That may
No.
initiate the process and kind of jumpstart things and get you on the right track. But healing is a process, it's a journey. And, even in your case, or in a lot of the patients that I see, they didn't develop this overnight.
Right.
It's 15, 20, 30 years sometimes of an ongoing process that got them to where they are. And it's not going to be reversed in a day, a week, or even a few months. Sometimes the healing process is really ongoing. And that's another part of our society, is that we've kind of been ingrained that we should have things now. We want to feel better now. We want to feel better yesterday. And that this is a thing that's going to take time, and people have to understand that it's a process and embrace the process.
Yeah. And that's one of my biggest challenges is when I talk to people who are looking at working with me, they know that I'm a nutritionist, and they somehow equate that with some kind of quick fix. Like, can I get a diet for, to lose 10 pounds in 2 days or something like that? And once, by now more people are coming to me that are similar to how I was. And so that is not as much of a problem. But when they come to me, it's like, this is not a quick fix. This is a process, and this is ongoing, and you need to wrap your brain around it. It's not going to happen overnight. And it's not about drinking a magic pill, potion, whatever to heal everything. It's a process.
Yeah, and I think for the most part, you know, today we're most of us are educated by TV, right? So
Yeah.
for every ache, illness, symptom, or sign you have, we've reclassified those things as diseases, and now there's a pill, a potion, or a solution
Mm-hmm.
to it, and it's a quick fix thing, right? You have reflux, take this, and you can eat whatever you want later, right?
Yes.
You have high blood sugar, don't worry about changing your diet, just take this medication, and it'll normalize your TSH. You'll be a well-managed diabetic.
Yeah.
The answer is that system can work to manage disease, but that's not really what most people want. And I think that's the big challenge when they come to see you. What they
Yes.
want is a simple solution to get healthy, but don't realize that what they see on TV many times is not a health solution, but a disease management solution. And
Yes.
that's not what we're doing as a nutritionist. That's not what we're doing as functional medicine practitioners. If
Right.
that is what the patient wants, then they should seek that out, and maybe we can help them in that journey to manage their signs and their symptoms. But ultimately, the biggest thing that somebody who's coming to a nutritionist or a functional medicine practitioner is to understand that we're looking at things totally different than your GP.
Yeah.
We're looking at things totally differently than allopathic medicine. It doesn't mean one is better than the other. There's a time and a place for both. What you need to decide as the person who's coming for help is, what do you want? I just
Mm-hmm.
want to lose 5 pounds to get in my dress. Oh, that's easy. I mean, that's an easy process, right?
Yeah. Very.
But that's not necessarily health, right? And I'm sure in your interaction with your clients, that's one of the first things to discuss is, what is it that you're looking for, right? Are you
Mm-hmm.
looking to get healthy, and what does that mean, right? Healthy. And are you looking for like a quick patch or a quick solution to address a sign or a symptom? Sometimes people think, well, I don't want to do medication, so just give me the supplements that'll fix it,
Mm-hmm.
and don't realize that the supplements, that's not really what their intention is.
Yeah, and that's the other thing I have found a little bit. Usually, people by the time they come to me, they've sort of gone down the road I had gone down, and many people gone down, and you know, just symptom or disease management, but not dealing with symptoms. And so they have that idea prior to coming to me that is much different than that. But I have had a handful of people who just want me to, do you have a supplement for this? Do you have a supplement for that? And it's like, you know, why are you taking that, or why do you think you need to take that? You know, you need to address, you know, some other things. But the bottom line is it's no different than wanting to take a prescription. They just want to take a supplement so they don't have to do the work. And then that's not who I work with. And you know, that's not really. I'm not helping them. They're not really, you know, getting what they need anyway. So there is a fair amount of that, but it's not as much as it used to be. But I find that kind of curious that, you know, you talk to people all the time, they're like, well, I can take a, you know, over the counter medication, or I can take a prescription that's really cheap with my insurance and it'll take care of the symptom. And people just are fine with that and want to do that. And then I was surprised to find people just want to take supplements just like a medication, but they're against medication, you know, so it's just kind of interesting. I had to kind of correct that, or kind of weed some of that out, because I don't want to work that way with people. I want people to actually heal. So,
And that's probably part of our job, right? Because
yeah,
people have been educated that that's the way to fix things, via TV, via their doctors, via,
yeah,
you know, mothers, fathers, teachers, preachers, right? Everybody's told them that the way to, if you've got this, just do this. If you've got this, just do that.
mm-hmm,
And we've been kind of taught the quick fix. So when they do come to see the nutritionist who says, hey, this is going to be, you know, a 3 to 6 to 12 month process to help you get to what you want.
right,
It can be a shock to the system, but that's our job, is to help them understand where they're at, right? Hey, that's not the way to that you're looking for a sprint, and this is an endurance race, right?
yeah,
So you have to have that mindset when you're going into this process. And I think Erica said this earlier really well, is, you know, for most people, what's driving their chronic health issues isn't a today thing or a yesterday thing. It's the accumulation of stress over time. And
mm-hmm,
so for the listener, you know, if we put your arm out, and we drop the 100-pound weight in your arm, I mean, you know, the weight would drop and you'd injure
yeah,
your arm, and you go, that created a problem. right?
Yes.
But what they don't realize is that holding the 5-pound weight out there over years and years, right, is going to create the same tissue damage. It just takes a lot longer. And for many of us, we've experienced chronic stress from early on in life, and we've adapted and we've adapted and we've adapted. And unfortunately, all that adaptation occurred slowly and steadily, but was slowly and steadily starting to erode our health, put us into a higher state of cell stress. And sometimes it only takes the death of a family member, the birth of a child, or a divorce, or losing your job, or a coronavirus to push you into the edge of being into that excessive response where you just can't adapt anymore, and the physiology shuts down.
Yeah, something's got to give, and it eventually does, and it manifests in many different ways. For me, it was that thyroid cancer, and I feel like for a lot of people, it's some thyroid dysfunction of some kind because of all that it does, and all that it, how it affects our body in so many different ways.
Yeah, so there's a lot. Thyroid physiology is, especially when we see thyroid dysfunction. I mean, hypothyroidism is the number one cause of is the number of autoimmune condition that we see. And probably the reason for that is thyroid hormone regulates metabolism. And if there's excessive cell stress, what's the body trying to do? It's trying to shut down metabolism. What's the best way to do that? Is to shut off the source. If you want to shut down metabolism, turn off the thing that's actually revving up the metabolism. You don't need as much of it, right?
Exactly.
So let's end the process, the podcast, by having you talk a little bit about the book, right? What's the name of the book? When is the book going to be released, and where can people get the book?
So it's the Rock Bottom Thyroid Treatment, and it is an 8-week diet to thrive, not just survive. So I kind of geared it towards people who were like me and so many other that had normal thyroid tests, quote unquote normal testing, and still had these symptoms. And so it'll be available July 16th. It'll be published on July 16th, and it'll be available anywhere where you buy books. And, obviously start at Amazon. That's where most people like to go. But so it's just going to take you through that process, give you some small wins to get you going and to realize what you can do to start feeling better. And it tells a little bit about my journey and how I got there, because I think it's very similar to a lot of other people's story.
And if somebody has an interest in learning more about you, where can they go?
My website's Rock Bottom Wellness, rockbottomwellness.com, and on Facebook, it's Rock Bottom Wellness. I have a Facebook group called Nutrition for Thyroid Health, and I have a podcast that's launching here pretty soon too. It's called Rock Bottom Wellness. So
awesome.
Fantastic. So I got one more question. I can't let go without this question, and that is Rock Bottom Wellness. So where does the name Rock Bottom Wellness come from? Is that the town? Does that have something to do with your story? What's Rock Bottom Wellness?
That's my story. I had hit rock bottom. I feel like a lot of people know what that means when people say I hit my rock bottom. I could not have felt worse. I could have not been less functional. I could not, but at the same time, I could not go on like that because I was not living at all. Like it was, not living would have been maybe easier. I don't know. It was the rock bottom. So that name, it was kind of funny. It came to me sort of in the middle of the night. I kind of woke up and was like, oh, that's the name of my business. Cause I think people get what that means. So that's what it is.
Excellent. That's what I anticipated it was, but I was waiting if you would have said, no, that's the town I met.
That's where I grew up.
Like, dang. But anyway, we appreciate you coming on the podcast. We look forward to the new book coming out. And when it comes out, we'll make sure that we get a copy of it. We can take a look through it. And awesome. I wish you best on the podcast. That'll be an adventure and some work as well.
Yeah.
And maybe we'll get you back on the podcast sometime in the future. Okay.
Sounds good. Thank you so much for having me. I really appreciate it.
No problem. Take care.
Okay. Bye.
All right, everybody. Thanks for tuning into the podcast. And if you are enjoying the Thyroid Answers podcast, make sure that you go to wherever you get your podcasts and give us a rating. I think there's usually 4 or 5 stars on the rating. Erica, is that right? And the place they're supposed to go is where? Do they go to the left or to the right when they rate?
whatever the most is.
The most. I think it's the
Yeah.
right stars.
I think it's the right,
Like
yeah.
it's the right. That's the one you want to check, and then make sure you tell your friends and your family. And if you are listening to the podcast, as I'm getting more and more people sending me little videos that they've shared our podcast as in their stories on Instagram where they're walking or they're doing something and listening to the podcast and giving us good feedback and response. If there's something we need to discuss that you have questions about and need some answers about, email Dr. Erica or myself, and we'll be sure to do an upcoming episode on that topic. And so we'll wrap this up. Again, Tiffany, thank you so much. And Erica, have a fantastic weekend.
Thank you.